Well, employers are cutting off insurance coverage related to the use of weight loss drugs as more and more people begin to use them. Spending on those drugs can cost as much as $1,350 a month for a patient, and that's quickly jumped into the tens of millions of dollars for insurance plans when you look at it cumulatively. And that's all according to the Wall Street Journal. Joining us now for more on this and all things healthcare, Meghan Fitzgerald, Grey Ghost Advisors, and a private equity investor and a Columbia University healthcare policy professor. Yahoo Finance's Anjali Kamlani is joining us as well. So, Meg, this really caught my eye this morning because we are at such an interesting cultural moment when it comes to this new class of weight loss drugs, which, by the way, aren't even weight loss drugs, right? This is an off-label use. So I just wonder kind of where we are in the usage cycle for them.
Yeah, I think we're in the early innings. I mean, this is a market and a class of drugs that could be targeted at half the population. So we have a long way to go before everyone who wants and more importantly needs these medicines get it. We also have 10 to 20 drugs in development, so there might be oral compounds before you know it here in the United States. So what you're seeing is two things. One, now that we're scaling and we're getting into more and more, we're going from thousands to hundred thousands now to millions of patients, you're starting to see one, more side effects, and two, more costs. So small employers who, were having costs in the hundreds of thousands a month, you saw the University of Texas now has a $5 million bill. Most of that bill is due to these medicines. They quite frankly couldn't afford it and canceled the program. So whether you're going to see more restrictions put on these medicines, higher copays, or just flat out, we're not covering this, I think we're going to see more of that because of the expense being borne by not only the employer, but also on the patient side.
Meg, let's talk about that because I know you and I could nerd on about this all day. But so we're seeing all of these restrictions. You've got the employers cutting off or restricting use, the insurers themselves requiring either prior authorization or not covering it at all for obesity, specifically that indication. And then you've got a lot of other conversations like the potential to bankrupt Medicare Part D, which some are saying is an exaggeration or on par. You've seen that in a market with all of this going on, still a shortage of the drug. What does that tell you about the demand and what we should be expecting if and when it gets covered?
Yeah, so I think it's fair to think Medicare Part D, if everyone eligible went on it, there's been a few papers to show how much that would cost. So I don't think that is an exaggeration. I think what's missing from the dialogue is the end benefit. If you were able to get obesity under control for many of these patients, what would you do for their cardiovascular health, for those that have diabetes, for those that are not exercising, musculoskeletal benefits? I think we need to have more data to show what it means to kind of get weight loss down in these patient populations. But I think it's a fair question and point that you raise, who's going to pay for it? Because it doesn't appear that the cost of the drug is coming down, which means two people get to bear that cost, either the payer and employer or the patient themselves. And right now we're seeing a lot put on the patient in terms of copay, and it's becoming cost prohibitive. One thing we don't also talk about is once you start these medicines, you're on them for life. As soon as you come off of them, you rebound right back largely to where you were, and you've also lost a lot of muscle mass. So this is something that really needs to be part of a metabolic program. One of the only programs I've seen in the nation so far has been Connecticut, that is looking to employ telehealth providers and the medicine as a holistic program to make sure you truly get the benefits of not just losing weight, but you also address nutrition and exercise.
Meg, do we know what percentage of these drugs are being used just in a discretionary fashion, for lack of a better word, off-label for people who aren't obese, who are using it for kind of run-of-the-mill weight loss, and who bears that cost? And then is there risk of a knock-on effect, a negative effect for people who actually need this stuff?
Yeah, I mean, that's what's going on right now. All insurance that I've seen covers it when it's diabetes, as it should. However, we've now crept into, as you said, off-label use, where people that don't have diabetes are running a script as if they were a diabetic, And for those that are actually using it legitimately for weight loss, are they really getting the drug based on just BMI? So some good clinicians are actually doing a full workup to even look at waist circumference and what patients have used before in addition to BMI. So I think there's a lot of leakage that we have a lot of patients who should not be on these drugs. They went on them first. And as a result, patients that genuinely need them for obesity, and more importantly, desperately need them clinically for diabetes, are not getting them because some people with cash and methods and ability to go up to a med spa are jumping the line. And that is problematic. And I think that's really why you're seeing employers and insurers quickly jump in with prior auths or even possibly evaluating canceling the program. I think it's very hard to discern who genuinely needs to be on this unless it's coming from a clinician and they're the ones doing the workup. And that's not really happening across the board.
Yeah, it seems like that. It seems pretty obvious that should be happening, but it's a shame it's not.